Hi, Dr. Jeff Lehrman, podiatrist in Delaware County, Pennsylvania. We were actually asked by request to make a video about big toe joint arthritis. When you look at the big toe, there are two bones in it, this one and this one, just like there are two bones in your thumb, here and here. And the big toe at its base forms a joint with this long bone behind it. And when you look at this big toe joint, it should be perfectly smooth, so that when the big toe bends, it just glides real nicely on that bone behind it, with nice, smooth, pristine joint surfaces on the inside. Where people sometimes get into trouble with their big toe joint is if the big toe is slightly crooked and is not perfectly lined up on the long bone behind it, if it's off a little bit this way, or if it's off a little bit this way, or looking from the side, if that long bone behind the big toe is slightly elevated, it can create a situation where when the big toe attempts to bend, you get an abnormal grinding and an abnormal wear and tear in that joint. Again, if this long bone is slightly elevated, when the big toe goes to bend, instead of it gliding nice and smooth in the joint as it should, you can get an abnormal grinding in there. Or when you look this way, if the big toe is off a little bit, when it goes to bend, you get an abnormal grinding and it's not moving nice and smooth, and that can be painful. And then what can happen over time is you can get abnormal bony growth on top of the joint as a result of all that wearing and tearing and grinding. Sometimes extra bone actually forms on top of the joint, which you can feel if you push on top of the joint outside your foot, and that can be painful. If this situation is happening, it's certainly a reason to come into the podiatrist and get it checked. We have several treatment options. We can do topical anti-inflammatory. It's often successfully addressed with injectable anti-inflammatory in the form of a shot. We make orthotics, custom-made devices that go in your shoes that can help to get pressure off that area. Our goal is always to keep you out of the operating room, but if everything fails, there's an option for surgery for this. Sometimes we just clean up the joint. Sometimes the alignment of the joint can be removed. In bad cases, a joint replacement can be considered, and even in some cases, a joint fusion is considered. There are many treatment options. So if this is a problem that's bothering you, please give us a call and come in and get it checked out.